Yeah, let's just get going. People will arrive as they arrive. Thank you all for coming. I'll just ask if you, just general Zoom rules, if you don't mind chucking yourselves on mute, and then if you need to talk then, just we'll keep the noise down. Firstly, just to acknowledge that I'm coming to you from the lands of the Wurundjeri people today, and I'd like to pay my respects to elders past, present, and emerging, and recognise that you're all coming from different country, potentially today, and also to acknowledge any Aboriginal or Torres Strait Islander people in the room, and thank them all for their continuing care of the land, seas, and skies that we live in. So you're here today for the Western Alliance info session for our grant round. This is our third iteration of the Rapid Research Translation Grants. So for just a bit of history, so Western Alliance has been around for nearly 10, or just over 10 years. And in that time, we used to run sort of general research grants. And so they were, I guess, focused at, all different parts of the research continuum. And they could be accessed by, I guess, both people within universities and health service members and primary care members. We've changed it a little bit over the years, and so there's, I guess, much more of a focus now on the translation of research evidence into practice, and there's also more of a focus on it being led from the health service and primary care side of things in partnership with our university partners. And so this is the third time we've approached the grants in this way. And I guess in plain language, part of the reason for that is that we want to see things change in our health settings. So we want the investment that we make is to end up with a change, a positive change in the health environments that you guys work and work in and use. And so we're an accredited research translation centre with the NHMRC, and so our remit is definitely on that translation side of research. While we recognised, that the other components of research are incredibly important and they all sort of form part of the same ecosystem, our investment now is at that pointy end. Any questions so far? No? All good. All right. So the way I normally run these sessions, and please feel free to stop me and offer a different way if it's of benefit, is to go through the expression of interest form and have a look at each section, and I can give you some fairly clear tips as to what we're looking for. What people may. How people might get caught in the wrong direction, and then sort of can give some examples of what we sort of would see as gold standard from previous submissions or more hypothetically. So I will share my screen with that document. Actually, while I'm doing that, I'd also just like to introduce, so I've got on the screen Olivia King, who is our capability building lead. If you haven't met Liv, she runs the STAR program among many other things. But I've also got Sarah Shaw, who's hiding behind her camera, but she'll put it on there. So Sarah is acting in our executive officer role at Western Alliance. So she will be the brains behind most of these initiatives over the next while, which is fantastic. So make yourself familiar with Sarah. And I don't think I have any of our research translation coordinators on. A couple of them are on leave at the moment. But if you haven't already met your local research translation coordinator, please reach out to us because they will be a good person to discuss your grant application with prior to submitting and can support you in developing that. All right, now, what was I sharing my screen? Has that worked? Can you see the document?
Yep.
Why can't I see it? See. That's interesting. I can see you all and I can't see the document. 2 seconds.
It might be showing up as a separate tab at the top of your window, Drew.
Could be. Here we go. There we go. Onto it. Okay. Now, as I move that screen, please tell me if it's moving down. It's not letting me move it. It's odd, I've never had this issue before. I'm just going to stop and try again. 2 seconds. Okay, that looks better. Can you see that?
Yep.
And is that moving as I move it?
Yep.
Perfect. All right, let's get straight into it. So just to recap, with these grants, we've got a total pool of up to $100,000, and that we look at up to $40,000 per project. So it doesn't mean the projects have to be pitched at that $40,000 level. And we will, as we move through the EOI round into the formal applications, we can give some advice as to where we think you might best pitch your particular project. And so to be eligible, you need to be from one of our member organizations, and you need to at least have a co-lead from one of our health services or PHN. But we can have joint chief investigators from both health services and university together. All right. So just sort of some prerequisites. So I mentioned around the co-design, it does really have to clearly be kind of co-designed by the health service side of things. And so it's not sort of something that's an academic idea that, you know, you've recruited a health service to be part of. It needs to be really clearly something that's a priority for that health service and led from or PHN. I've mentioned here that we need to see a meaningful approach to consumer and community co-design and engagement. And I'll talk a little bit more about this as we go on, but just to say that in the EOI stage, we don't expect that you're going to have all of that sorted. But we do, and what we're doing for the first time this year is offering access to some funds for those who make it through the EOI stage to then go and use those funds to pay consumers to be involved in the co-design for the full application, if that's required. So we do really want to see by full application stage that you have, you know, you've got consumers who have given you advice and been part of that development of the project. And we will have consumers on our review panels. We'll have 2 consumers on the review panel, and they'll be specifically looking at those sections. And look, that's pretty much standard now in most research type grants, particularly when there's a translation aspect. So we're sort of bringing that in line to what's the national approach. I've said here it needs to be led by investigators with the ability to influence transactional change. So, you know, ideally your principal investigator will be able to make the change that we're talking about, or there'll be other people on the grant who can kind of support that change in the health setting. And also, if you're not aware of what Maranagu Maragura is, it's the Victorian Aboriginal Health and Medical and Wellbeing Research Accord. And all of our projects need to make sure they align with those principles. So if you are working with community or for community, in an ideal world, we'd want to see Aboriginal or Torres Strait Islander people involved in that project and being involved in the co-design. And there's a link there to the Accord so that you can see what other kind of expectations come from them. Any questions so far? And I can't see you all on the screen now, so please just take yourself off Zoom and shout out at any time. All good? Okay, and you've seen the dates there. You've still got quite a bit of time. Let's run into the first section. This is just all admin sort of stuff. But yell out if you've got questions on any of these things I'm running through now. Okay. I have had a few questions around collaboration. In an ideal world, we'd love to see, you know, multiple Western Alliance partners collaborating on these grants. And that certainly is part of the criteria to have, multiple people on the project. If it makes sense. So if your grant is really only at this stage proposing something that's in one health service or one primary care setting, that's totally fine. And don't just do it for the sake of doing it. But if there's a clear benefit of involving multiple services, whether that's around scaling or understanding how others are doing it, then that's great. You can involve non-Western Alliance member organisations, but we want to see the bulk of the work happening in a Western Alliance health setting. Okay, so lay summary. Now, I guess with this, just remembering that we do have consumers on the panel, we want this lay summary to really be a lay summary. Okay, so we want anyone to be able to pick this up and read it and understand what you're trying to do. And the best way to test that is to run it by someone who has nothing to do with that project or with research or with health, and see and test it on them and read it out to yourself and read it out to them and make sure that makes sense. So this is the first impression we're going to get, and we need to understand in 200 words what you're trying to do with this lay summary. And I know that sounds simple, but it's a really tricky thing to get right. If anyone on here, I know many of you have had plenty of experience in this. If anyone wants to jump in with other tips on the lay summary, then please do. Or Liv, from a staff perspective, please also jump in.
Actually, Drew, I will just say one thing. Even just reading it out loud. So when you actually read something that you've written out loud, sometimes that can give you a bit of a sense of how it's going to land at the other end.
Yeah. And I think I mentioned this in one other info session, but colleagues of mine at Melbourne Uni have an internal rule that anything that they're putting forward, any sort of submission, they have to do a full readout to the team, so that they can, sense check it by reading it out. And I think I've started doing it for certain things, and I think it's a really nice way to understand, whether what you've put down on paper is actually what you're thinking. So might be something to consider. All right, overview of the identified problem. Now, the keywords here, please include local data where applicable and indicate why addressing this problem is a priority for the participating health service. This is at EOI stage. I would say this is probably the most, or one of the most important components of this application. So what we're trying to understand here is this something that your service cares about enough to want to make it change? Is the problem, is the magnitude of this problem, does it require investment and a need to change? And so to demonstrate that, we want to know, I guess, at this point, how do you know it's a problem? So is this just a hunch that you have from your practice, and if that's the case, that's okay. And you may be pitching that as part of this, you're going to better analyze the problem. But in an ideal world, we'd want to know that you've already collected data that's demonstrated you have a problem, and you've linked that back to it being a priority for your service. So how can you do that? It might be that your service has strategic priorities already. They may have them specifically for research or more generally, and you may want to link it back to those. Or you may just want to demonstrate the impact that the problem is having at a local level, whether that be for the health service or primary care users. It might be for staff, it might be for the organisation, so it might be a cost issue, so on. But this is your opportunity to demonstrate why it's an issue, how you know it's an issue, and why it's a priority for that service. So I'll give you sort of a basic example. If you're focusing on, say, if it's around falls that are an issue in your health service, and in your application, you're saying, we want to, in your lay summary, you said, we're going to do X, Y, and Z that's, been tested and we know it's going to reduce falls. Here, I want to see what your falls rate is and how that compares to other services, or for example. So you've got to demonstrate that this really is an issue. And then potentially you might be putting here, what that means at a patient level. So, if you've got X amount of people falling, this is X amount of people who, can't get home, spending more time in hospital, which is worse for them, whatever it is. So that impact.
Can I just ask, sorry,
yes,
Drew, can I just ask a
please
question? I'm Christine, I work for Grampians Health Ballarat in residential inReach, and I'm planning to implement weekly visits to the private aged care facilities to build relationships and trust in the hope of detecting clinical deterioration early and reduce the public hospital ED presentations. Is that something that aligns with the with you guys?
Ooh, good question. And I would be happy to, I guess you don't want to give all your secrets away in this forum to start with, but we do love sharing here.
Okay.
So no, would be happy to have a chat specifically with you about your topic idea, but
Okay.
generally, yes. I mean, what we're looking for, and I guess this is where we differ to other grants and what we used to do, is that you need to demonstrate that we already know that it's a good idea to do that. So if you're saying that's what you're going to do, why is that? So has someone else done it and they've demonstrated it works? Have you guys already tested it and you've demonstrated it works? And then what
Mm.
I'd want to see for you in this section with your issue is, okay, so what with your issue in terms of requiring InReach, what has got you to that point? So what are the figures at your local level
Mm.
that are demonstrating that you really need to implement what you're talking about?
Yep.
And we do have another section where you'll then get to demonstrate the evidence for that. But at this point, really, yeah. And you can, I mean, this is also a section where you can bring in more general evidence. So, we know that this is an issue in Australia or Victoria or whatever, or in rural areas. But yeah, the focus here, I think we need to understand that what we're investing in is worth investing in
Oh,
from a problem.
thank you.
All good. Any other questions on that section? Because as I said, that is, if you can get that section right, we know that the idea, what we're trying to do with this EOI is get project ideas through that have the potential to make that change and to build the other things around it. So at this stage, if we can get this bit right, the other things can perhaps come a bit later. But if you don't have the idea right, then it's really hard to, the methodology doesn't make much difference to us if it's not a priority, for example. Cool. Shall I move on? Okay, so what has been done so far to address this problem? So include an overview of the evidence and any pilot programs or other efforts to address the problem. So this is your chance to bring in both what you guys have done, if you have done, and you might not have done anything to address it. So that's good. That's might mean that it's worthy for investment. But somewhere in the evidence, someone will have probably done something about it. Okay. And we need to see that when we're not, this grant round is to not to test new theories and provide evidence to other people. It's really to find things that already have reasonable evidence enough to know that you should make the change that you're talking about. All right, so we do expect that you will have done sort of a review. It doesn't need to be a systematic review. We're certainly not expecting that, but there needs to be enough in the literature to demonstrate that it's worth something worth continuing with. Any questions with this one? Right. Cool. Easy. We're getting there. Okay, so this now is your chance to tell us what you're going to do. So your overview of your proposed translation project. And I use the word change in here because that's really what the language that we want to talk about. So what are you proposing to change and how are you what are the basic steps you're going to do to get there? You don't have to know exactly what you're going to do at this point in time. So you might still be working this idea up, and in the next, if you get through to the more formal application, you'll have an opportunity to really lay that out in sort of more scientific format. But really, I want to know here, what are you intending to change, and yeah, how do you think at this stage you'd go about that? And this is also your opportunity to demonstrate how you'll engage consumers and community members. If you've already done that, please put it in here. That's fantastic, and we want to see that. But as I said before, you will have that opportunity in the if you get through to the next round to really focus on that. Okay. Any questions on that one? Yeah. So we're getting closer to the end. So we've tried to make this EOI, I guess, as painless as possible. I know it's hard with word limits, but we really don't want you to be, we want to keep it fairly short and sharp. And we don't want you to waste your time if the idea is not something that fits with this grant. So this will give us a real sense as to whether it's the right type of idea for the grant. And then the intended impacts of the translation or policy or practice change. So most things we are not doing just for the reason of doing them, and this is often one that gets missed in a lot of research type applications and research translation applications. Okay, so you're making your change. What does that mean? What's going to happen? And we talk about an 18-month time frame. Look, I'm not completely hell-bent on that. Like, if you can demonstrate that you're going to do it more, certainly more quickly, but if you're going to need a little bit longer for whatever reason, then that's okay. But the reason we've landed on this kind of time frame is that if there's already evidence for it, and you've already worked up the idea, then it's around that implementation, and this seems to be a reasonable sweet spot for that. But happy to hear otherwise. So we want to know, if you're going to make that change, you've talked to us about the data that you've put in. How are you going to impact that data? Is that going to change as a result, or is that a step away? And if so, that's okay. But ultimately, we want to know what that change will mean for your practice, for the people you're working with, for the service users, whatever it may be. Any questions on impact? And again, it's only 200 words. It's fairly short and sharp. We don't expect really, really in-depth kind of scientific answers to these things. And proposed partnering organizations. So this is just listing who is going to be involved, particularly being really clear about where the change is going to happen. So sometimes people get a little bit lost with, they might have list 6 partner organizations down there who are providing some support, and then the change might only be happening in one of those. Just be really clear about that and what the roles of those organizations are in there. And I mentioned before, it's great to have collaboration, particularly with our member organizations, but don't just bring people in for the sake of it, because it gets messier, and we can definitely tell if people have just been sort of brought in to kind of strengthen the grant. If there's no reason for that, this is the opportunity where health services and primary care can particularly lead these sort of things. And yes, we do like to see academic support behind that if you don't have it already within your health service. But you don't need to stack this grant like an NHMRC grant to demonstrate that you're ticking every single box with every single researcher. So that's it. It's pretty short and sharp and pretty straightforward. As I said, once you get through this round, the next round is sort of an expansion on this. So similar questions, but with more detail. And we talk more about the methodology about how you're going to make that change and budget, etc. So you don't have to put a budget in this. And then, as I said, also, if you do get through to the next round, we'll have a chat to you about sort of where you might want to pitch, or have a discussion around where you think is realistic for your type of project. Liv, Sarah, anyone else, have I missed anything in this bit? And then I'll open it to general questions. I'll stop sharing so I can see you all too. Cool.
Just remembering the 2-page CV for the principal investigators.
Thank you. Yes. And again, that's not a traditional academic CV. So, I mentioned before, we're wanting to see the people who are well placed to make this change. So you might be a very novice researcher, but in that case, you might have a backup from one of our university partners. But you'd be putting in that CV, the relevant part of your role that will support this change. Questions? Then we must have some, or many. And I would really encourage you to talk to either me or your research translation coordinators beforehand, so that we can steer you in the right direction. I don't sit on the panel. We have an external panel for these, and that is very much intentional, so that I can give advice equally, give everyone the same advice. But again, we aren't the NHMRC, and we have, part of this is trying to raise important projects in the region and get them up there. We're not trying to put barriers in place to those happening. So we really want to encourage people to get amongst it.
Do I have a question?
Go for it.
Just in regards to the consumer engagement and community consumers, I guess if we are looking at implementing a practice that we know to be successful in other places, and the aim of that practice is, of course, to end up with improved patient outcomes, being that the intervention itself is targeted at the healthcare professionals, are you interested in mostly having them as the consumer representatives or the community? Yep.
That's a great question. Yeah, sorry. No, I'll expand on that a bit if you like. Keep
Yeah,
going.
that's great. Thank you very much.
Oh, cool. Yeah. All right. So this has come up quite a bit actually around in a kind of staff targeted change. Who is the consumer in that sense, or the community member? And there's two layers to this. One, yes, we don't expect you to, if the change isn't directly relevant to a service user in that sense, or a lived experience consumer, then your staff member would be the target audience there, and they should be involved in that co-design for sure. But there's usually a knock-on effect to whatever we're doing in these situations that will impact lived experience or consumers or service users and community members. So I want you to consider that and consider whether, and we can have a talk to you about that. What I don't want is you to bring in a consumer just for the sake of it because you have to tick a box. That is certainly not what we're intending. So there needs to be a relevant reason for them to be providing their time to support the application. And we do really encourage consumers to be put forward as investigators. That is, that's becoming standard now. And, that's certainly something we'd like to see built in to the grant. Thanks, Renee. Great question. Anyone else? What have I missed? I must have missed something here. This has gone too quick. Stephen,
Drew, I don't have a question because you were so thorough. But I just wanted to say thanks to the Western Alliance for offering the grant. I think these grants really fill a sweet spot in the whole menu of grants that are available out there, and I think they're really important. So thanks to the Western Alliance for doing that.
Thank you, Stephen. Appreciate that. And we are always learning with this. I think we feel like we've hit something at the moment that's working, but we're always open to suggestion with how we use the funds. So, I talk to my colleagues across Australia all the time, and, some don't have grants, some have different size grants, and we're always trying to understand what kind of works and where that balance is best achieved. So we could obviously have, more grants with less funding for each one, but then that becomes difficult. So yeah, we're always open to what works from you guys to better understand that.
Great, thank you.
Sammy.
I was just wondering, I know you said the timeline, the 15 months has a bit of wiggle room. How much wiggle room is that? In terms of ethics from Grampians Health, a lot of our stuff is obviously very early days. We haven't applied for any ethics at all because we want to see if we can get the grant to help out. But ethics can take quite a while depending on the project. And I just want to make sure that we might actually have time to do it within the 15 months.
Yeah. Look, no, and I guess that's where the wiggle room really comes in. So we understand that ethics takes time and it's different in each organization, and governance is tricky. So the intention is that it's not, and I guess the time frame really is to frame the expectations of the grant. Like, it's not something, this is not supposed to be a 5-year, really well-funded kind of intervention that you've got to go really in depth with. We've put that there so that you can, I guess, have the freedom to know that you can take something and put it in place and test it, whether that's, whether the grant is focused on evaluating that change or whether it's focused on the specific implementation of that change. 18 months again, yeah. So it seems to be about the right kind of target to keep people on track. But we've put out, I think we've had 70 grants in 10 years, and I think maybe we've had 5 that have finished on the time that they said they would. So we totally get that people you know, things take longer than you anticipate. Workforce stuff is tricky. COVID happens, you know, all those sort of things. So what I'm saying is that if you put 18 months in there and you have a valid reason why you can't get to that, we're very open to changing that.
That's very good to hear. Thanks.
All good. Actually just reminded me about, you know, we often get questions around where to focus this grant. Like, you know, should you focus on a scaling activity? Should you focus on, and really we don't mind, as long as it's like as long as you're demonstrating that you're doing it, you're going to make the change as part of this grant. You're not going to, you know, the change doesn't happen just on its own as a result of this. Like it has to be the focus. Okay. So that could be that your focus is on kind of supporting the implementation. It could be, as I said before, that you want to evaluate that implementation to then know, you know, how it's worked and how you change it. It might be purely a scaling mechanism, so that, you know, you've tried something or someone else has tried something and you want to spread that across a different area. Yeah, so there are a few different ways to do, I guess, research translation in the way that we're thinking about it. But it has to lead to that change in the time frame that we're talking about. Whereas most research projects will intend to make a change, but often that comes after the project. Renee, sorry.
No, that's okay. Just curious about how much appetite there might be for outcomes that include capacity building for clinicians who want to enter the research space. And an extension of that is what kind of capacity there might be to join the STAR program if there was clinicians who are interested.
Yeah, really good question. It's certainly not the focus of this grant. And when I say that, I mean that we do have specific grants that are focused on capability building. So as part of the STAR program, for people who don't know, the STAR cohort then gets an opportunity to apply for grants, both kind of an emerging researcher grant and a STARship fellowship, that really do have a much bigger focus on building their own capability. We would love to see it be a part of this. If you know, I think, you know, by proxy, these grants do build capability, particularly in the health services, because it gives people that opportunity as sort of a next step from things they've previously done. But it's not intended to be the focus of the investment, if that makes sense. So the clear focus here is to get the change happening in the whatever setting it is that you're pitching. And if the capability building happens as a part of that, that's great. And you can demonstrate, you know, in your EOI how that might occur. But it's not something we're specifically requiring as part of the grant.
Okay, thank you.
All good. Any other questions? And this isn't your last opportunity to ask a question. As I said, I'm very happy for you to just pick up the phone and give me a call. I'd much prefer that. It actually saves a lot of time over time. So, you know, what will waste your time and ours is if you've spoken to no one, you put it in and it's not the right fit. And it's always really difficult to give that feedback. And I will say that we do, when you put an EOI in, we do offer to sit down with each of you and talk through your EOI. And I do really encourage you to do that. Because I'll take the panel's feedback and have a chat with you about how you might repitch it for a future one if it hasn't been successful. But also, if you have got through to the next stage, we want to help you to get it as kind of ready as possible for that final stage. So we do really encourage you to talk to us and maintain that dialogue as we go through the process. We have talked about doing kind of interviews at some point, but I actually think, you know, when we have a conversation with people, we can kind of get a sense of what we'd get in an interview anyway. And we don't want to we don't want to put unnecessary barriers up to getting you this funding. So we're just kind of evolving as we go with the way we review it. Excellent. All right, well, I'll give you some time back in your day that you might not have accounted for. And yeah, as I said, please give us a call, send us an email, whether that's myself or particularly your research translation coordinator in your area. They're very much across these grants. they will be able to steer you in the right direction as well. Thanks so much for coming, and we look forward to seeing your applications.
Right. Thanks, Drew.
See you, everyone.
Bye all.